Welcome to New Hampshire's Business. I'm Fred Coker. This week has been Nurse Appreciation Week, and I appreciate them. So it's tough to report that the word crisis is being used by many to describe a nurse and workforce shortage in hospitals across New Hampshire. Here are some quotes and numbers that make the point. We were facing a global nursing shortage before the pandemic began. It has just escalated. That's from my guest. And New Hampshire is projected to be 10th among U.S. states with the most severe nursing shortages, and that is from New Hampshire Endowment for Health. The state is short by at least 1,000 LNAs, licensed nurse and assistants, from a New Hampshire consultant. And Dartmouth Health has 400 temporary nurses and agency staff members, but wants permanent staff. And that's from the Executive VP, my guest. And then finally, our rural hospitals and healthcare systems continue to lose money. That's from the CEO of Dartmouth Health. With me is a key person in New Hampshire who is sounding the alarm, but also working on solutions. Susan Reeves, the Executive Vice President and Chief of Nursing Executive Vice President at Dartmouth-Hitchcock and Chief of Nursing at Dartmouth Health, which includes hospitals at Lebanon, New London, Keene, Windsor, Vermont, and clinics and visiting nurses across New Hampshire. Welcome.
Thank you.
Nice to have you here. What keeps the nursing shortage keep going in New Hampshire? What is behind it? What are the drivers?
The nursing shortage was actually something that we were anticipating prior to the pandemic. We were looking at how many nurses were in the workforce and how many we were projected to need going into the future. A large number of our workforce is coming into retirement age, so we needed to get ready to plan for that. But what's going to keep it going now is we need more people to choose nursing as a career. Okay.
How about housing up in the Upper Valley in particular?
Housing's a challenge throughout the state, and in the Upper Valley in particular, it's something that we're working to address very actively in our communities.
Dartmouth Health and other hospitals are using traveling nurses, as you well know. They come from out of state in many ways to fill the vacancies, and they reportedly cost hospitals, from our information, up to $7,000 to $8,000 a week, whereas a staff registered nurse might make that in a month. What do you see this trend continuing in the near future?
Traveling nurses fill a really important part of the nursing workforce shortage right now. Right. So they help us address making sure we have adequate supplies of nursing to take care of the patients who present to us for care. Obviously, we would much prefer to have nurses who are part of our own workforce joining our organizations and be part of our teams and not coming and going. But in the meantime, we're very grateful that we have them. Their prices, which were really elevated during the pandemic, have now returned to the pre-pandemic rates, which we're very grateful for.
What's the salary for a registered nurse with experience at Dartmouth-Hitchcock, for instance?
So depending on the level of experience, again, some nurses are in the workforce for decades, and so their salary tends to escalate along with their time in service as their experience grows. But an average salary for a registered nurse right now is probably, with experience, is probably between $50 and $60 an hour.
And you're a registered nurse, I might add.
I am.
Your CEO says hospitals, rural hospitals and healthcare systems are losing money. Why?
I think it's a combination of issues that contribute to the loss of money. Obviously, during the pandemic, many of the services that we provide, we were encouraging people to not be in the hospital unless they absolutely needed to be. So we actually saw hospital revenue drop quite a bit during the pandemic. I think since the pandemic the effects have decreased, we are seeing a return of our patients to come in and receive care that either they might have deferred during that time or they now need at this point.
You have a very strong relationship with Colby Sawyer College in New London, where you used to be dean for nursing, and that is critical to your recovery in terms of permanent nurses. Is that right?
That's right. So again, these are called academic practice partnerships. It's the ability of a health organization, healthcare organization, to join with an academic organization, really to look at what is the workforce development need, and then to actually work with those academic organizations to help put in programs and degrees that help meet that need. And we were very fortunate that Colby Sawyer was right there for us.
Susan Reeves, Executive Vice President of Dartmouth Hitchcock, and Chief Nursing Officer for Dartmouth Health. Thank you.
Thank you, Fred.
And if you missed part of this briefing, you can go to WMUR.com, where it will be posted all this week.